In talking to your healthcare provider, and if you're not used to seeing doctors, you have to remember that doctors really are here for you. And it's probably best to be well prepared for your visit. What I mean by that is to plan ahead. It's good to have notes in front of you. You want to write down things, plan ahead for what it is that you want to happen at the doctor's visit. You want to think about what is it that's important for you? What is it that you want to get out of the visit? And let them know. Write it down. I want to make sure that I stay healthy. I want to walk better. I want to hear better. I want to get rid of this pain. And then you want to make sure that when you're with your doctor that there's no barriers to communication. What I mean is you want to make sure that you can hear okay. If you have any hearing problems, make sure you bring your hearing aid. If you have any visual problems, any trouble seeing, bring your glasses.
If you're a patient who speaks a language other than English or does not understand English very well, let your healthcare provider know ahead of time that you would need an interpreter. If you happen to come to the visit and are not fully understanding or comprehending what the provider is telling you, make sure you stop them and do not hesitate to ask for an interpreter.
You should know that doctors are really interested in you as a whole. So health means whole, and your whole being is not just your physical health, but your emotional health, your feelings. And sometimes it's hard to separate out what is your physical health and what's your emotional health. Since they're tied together, what might feel like emotional health might be physical, and what might feel like physical might actually be emotional. And so many doctors will automatically ask you questions about your mood. In the past couple of weeks, have you felt down or blue? Have you had sadness? And those are things that the doctor wants to know about. So they make that part of the visit. And so I think you should feel comfortable talking to your doctor about that.
If you do not feel comfortable with the provider you saw today, it is okay to ask to see somebody else, somebody you will feel more comfortable with.
Pharmacists can provide a lot of information about harmful side effects from medication, harmful drug interactions, and the proper way to take prescription medication or over-the-counter products. The easiest way to communicate with the pharmacist would either be when you're picking up your prescription and directly ask any of your questions, or you can call the pharmacy and ask to speak with the pharmacist that way.
The library is always a great place to start to find information. You should check your local library to see what resources they have. Here at the Nashville Public Library, we have computer classes, we have access to our public computers, we have the internet, we have fax machines and copiers, and we also have information in other languages. A good resource for finding information about supplements and medication that you're on is Medline Plus. It'll let you search to look up the drugs or supplements that you're on. You can also find other information about various diseases or diagnoses you've had from your doctor.
Electronic medical record, also known as an EMR, is a doctor's record of your health. It allows the doctor to be able to enter data and extract the data from the computer. And it's available to other providers in your practice if they're covering. They can know everything about your medical information, history, etc., so they can take care of you. So on your medical record, it would include your past medical history, your current medication list, and any allergies that you might have. Oftentimes, in order for him to be efficient, you'll need to be doing the entering of the data at the time when you're in the exam room. So your health information is protected. You really don't have to worry about privacy. The record is maintained, and there are laws regulating the release of any kind of medical information.
Patient Portal is an online tool that allows you to access information from your electronic health record, such as notes they may have taken during your visit, your vital signs, an up-to-date list of your medications, allergies, x-ray reports, lab reports, or other studies. It will also allow you to see updated family history, medical history. It may also allow you the opportunity to communicate with your provider and their staff. Patient Portal is not for emergencies. It's for you to have the opportunity, if it does give you the option to communicate via email to your provider, to do things such as schedule an appointment, cancel an appointment, maybe update your pharmacy information. Remember, your health information is private. So if your provider does have a portal, you'll need to gain access with a password. You should call your provider to find out if they do have a portal and the best way for you to get into their website.
If you're coming to see a doctor and you haven't been to one for a while, you may be a little nervous how to get the most out of your visit with the doctor. First of all, doctors really are here for you. They want to help you. But you need to feel that. You need to feel that they are partnering with you. And you need to feel like the person you're talking to is someone that you're comfortable with, that you trust, that you feel able to ask questions and trust what they're going to say. It's very important.